we are going to look at some opportunistic infections. Opportunistic infections as well as the HIV related conditions. HIV related conditions and also the ART initiation. So now we are going to see the clinical scenario. The clinical scenario first will be in case of any undiagnosed active infection with fever. So undiagnosed active infection, and this is with case of with fever. So this is the condition. Now what is the action here? The action is first to diagnose and treat. So you diagnose, then you treat, and what do you start with? You start with the ART, antiretroviral therapy. So this is given when it is stable. Next we see in case of the patient with the TB. So TB stands for in case of the tuberculosis. So in case of tuberculosis, you start the TB first. So start the TB treatment first and then you start the ART ASAP. So start ART ASAP. ASAP stands for as soon as possible, and after 2 weeks and before 2 months. So after 2 weeks. So start it immediately after 2 weeks. Or you have to start immediately, that before 2 months. Before 2 months. Next is for those with the CD4. So you also look at the CD4 levels. So in case of CD4 levels, it is less than 50. So CD4 levels, if it is less than 50 per cmm, then what you do is start with ART within 2 weeks. So start the ART. So ART is started within 2 weeks. Within 2 weeks, you start the ART, and a caution is needed for the PLHIV. So you do the caution for the PLHIV with TB meningitis. So since immediate ART is associated with more severe adverse events than initiating the ART 2 months after the start of TB treatment. So ART 2 months after the start of the TB treatment. Next we'll look at the pneumocystis pneumonia. So the pneumocystis pneumonia. So pneumocystis pneumonia in short is known as the PCP. And here, how is the treatment? First you treat the PCP and then you start the ART. And then you start ART, and this is when the PCP is completed. Treatment is complete. Then we move on to some fungal infections. What is this? The invasive fungal diseases. So we are looking at the invasive fungal diseases. So invasive fungal diseases. So what does this include? This includes the esophageal. So esophageal candidiasis, as well as there is a penicillosis and the histoplasmosis. So here, how do you treat? First you start the treatment for the esophageal candidiasis. So this is done first, and then you start the ART. You start the ART as soon as the patient can swallow comfortably. So ART is done when the patient can swallow. And then you treat the penicillosis. So you treat the penicillosis and also the histoplasmosis. So this is done, and then you start the ART. So then you start the ART. So ART when the patient is stabilized. So ART when the patient is stabilized, or opportunistic infection treatment is complete. Opportunistic infection. So OI treatment is completed. You proceed with this. Next, we will move on to the cryptococcal meningitis. So in case of the cryptococcal meningitis, how is it? So cryptococcal meningitis. So under the cryptococcal meningitis, first you treat the cryptococcal meningitis. First you treat this condition, and then you start the ART. So then the ART initiation should be deferred. So the ART initiation, it should be deferred until there is evidence. So it should be deferred. So ART should be deferred until there is evidence of sustained clinical response. So until there is evidence of the sustained clinical response to the antifungal therapy. And after 4 weeks of the induction and consolidation treatment, and after the 4 weeks of the induction and the consolidation treatment, and this is the amphotericin B containing regimen. Next, we look at the bacterial pneumonia. We are looking at the bacterial pneumonia. So in terms of the bacterial pneumonia, first we treat the pneumonia. So treat the pneumonia, and then you start the ART. When the treatment is complete. And then we move on to malaria. So how is malaria done? In case of malaria, first you treat the malaria. So treat the malaria, and then you start the ART when the treatment is complete. Then we look at the acute diarrhea. See, acute diarrhea which may reduce absorption of ART. So it may reduce the absorption of the ART. So here what we need to know is that to diagnose the cause, first you diagnose the cause, and then you treat the diarrhea. They diagnose the cause and treat the diarrhea first, and then you start the ART when the diarrhea is stabilized. So when it is stabilized, when the stabilization of the diarrhea is done, then you start the ART. Next, we move on to the non and the severe anemia. So in case of the non-severe anemia, so non-severe anemia is basically the HB. So here the HB, it goes less than 9 gram per dl. So here you start the ART if no other causes for the anemia are found. So no other cause of anemia is found, you start with the ART. So HIV is often the cause of the anemia. So mainly you can say the HIV is the main cause of the anemia. Next, we move on to the skin conditions such as the PPE. So skin conditions. So we look at the skin condition. So skin conditions such as the PPE and also the seborrheic. This is the dermatitis, seborrheic dermatitis, as well as we look at the psoriasis, seborrheic dermatitis, psoriasis, and also the HIV related exfoliative dermatitis. So here in this case we start the ART. And the ART may resolve these problems. So you start with the ART. Next, what we do is we look at the suspected mycobacterium. So we look at the suspected mycobacterium and mycobacterium avium, as well as we look at the avium complex. So in short, it is known as the MAC. Next, there is also the cryptosporidiosis and the microsporidiosis. So in such cases, what we do is we start the ART. So we start the ART, and here what we need to know is the ART may resolve these problems. So the ART may resolve the problems. Next, we will look at the CMV, that is the cytomegalovirus. So cytomegalovirus retinitis. So in terms of the cytomegalovirus retinitis, you start treatment for the CMV. So CMV urgently and start the ART. So you treat it urgently and then you start the ART. So ART is after 2 weeks of the CMV treatment. After 2 weeks of the CMV treatment, you go ahead with the ART. Next, we move on lastly to the toxoplasmosis. So how do you treat toxoplasmosis? So toxoplasmosis is when the treatment of the toxoplasmosis, and then you start the ART. And this is after 6 weeks. This is after 6 weeks, and this is after 6 weeks of the treatment, and when the patient is stabilized. So this was about, we dealt with the opportunistic infections on the HIV related conditions and the ART initiation. So to learn and grow more like this, please do subscribe.